Welcome to the About the Face podcast, sponsored by the American Academy of Facial Plastic and Reconstructive Surgery through the Facial Plastic Surgery and Aesthetic Medicine Journal.
Hello, this is Berke Özücer. I'm a European board certified facial plastic surgeon from Istanbul, Turkey, and I'm the author of Surgical Pearls for Safe and Precise Decision Making During Modified Selective Neurectomy Surgery. Okay, I am in private practice in Istanbul, and I've been doing modified selective neurectomy surgeries for the last 4 years, and I shared some tips and tricks that will enable surgeons from all over the world. These are very simple tricks that are applicable to everyone. So the first one is to using a TENS stimulator, a very basic commercial TENS stimulator, which enables the surgeon to use biphasic waveform stimulation for reproducible and predictable decision making during surgery. And we have also attached a video on how to do this. And this will enable all surgeons from all over the world who are underprivileged and the ones that cannot use disposable devices that don't have neurointegrity monitors, they will be able to do this surgery with this. I have done nearly 100 cases with this, including parotidectomies, lots of deep plane facelifts, and I have been using this device, and this lets me avoid facial nerve damage and allows me to do neurectomies very safely, predictably, and cheaply. So I have shared all my details there. And the second tip I would like to share with you in this article is that we are using a very simple shatterproof mirror. It has to be shatterproof because it can break during the operation and hurt the patient. So this mirror allows for the surgeon to see the operative field, the plane, and the face mimicry while doing this surgery. So simultaneously, you can both be the primary surgeon who stimulates the nerve and who gets feedback from the mirror, visual feedback. So you can stimulate hundreds of times, and the biphasic waveform of the TENS stimulator enables harm-free surgery and postoperatively. We will be sharing our data in the future. We are doing data collection, but we don't have postoperative weakness. I will not say never, but it's very highly unlikely in my hands with these techniques. And this enables you to stimulate and do it simultaneously. So you can do hundreds of stimulations, hundreds of feedbacks, which will give you lots of data to give the best decisions possible. Because this surgery requires multiple very good decision-making steps. And it's very, during the surgery, it can be stressful for the novice surgeon and it can be very burdensome. So this lets you'll see in the video, it's very practical. It's much easier for everyone. We have tried GoPro, we have tried high quality 4K videos, screens, lots of stuff. And the best solution we have come up with is the simplest solution. And I hope many surgeons will benefit from this, and this will make your surgeries shorter and hopefully will expedite your learning curve while you're decision making, and make sure you get less tired when trying to give the best decisions for your patients, hopefully. And this is also very cheap and very applicable all around the world. And the third tip and trick we are sharing in this article, briefly, but the algorithm of going distal whenever you are in ambiguity. This gives you predictable and optimal neurectomies, and it gives you maximal preservation. So what this does is that normally, as it was introduced and pioneered by Dr. Babak Azizadeh, in this surgery, preserved branches are tagged red, and the synkinetic branches that are causing disfigurement and deformity are tagged blue. This is how it should be done. In the literature, there's a little problem about that, which we underlined in our article. But what we introduce in this article is introducing a third color for ambiguity. When you are trying to give a decision, but you cannot decide during surgery, which will happen to many surgeons at many stages. You will stimulate a branch, and due to the distal sub-branches of that branch, you will not be able to decide if you will preserve it or if you will sacrifice it or transect it. So whenever this happens, you will see much clarity. We have depicted this with figures, and in the video, this is also very clearly explained by us. We introduce using the yellow tag and going distal. Going distal is more burdensome, but gives you much more predictable and much more optimal. We believe this increases satisfaction during the surgery. And how distal, you may ask? The answer is as distal as the muscle. That's the end point, So this is the second summary. And hopefully you will see that these are very simple as it should be in a surgical pearl publication, which allows only 800 words. But you will see that these are simple but nice tricks that will make your surgeries hopefully easier, much more satisfactory, and the primum non nocere, not harming the patient, and not transecting branches, preservation as much as possible at its highest is what protects the beautiful healthy movement, and only transecting the necessary branches, but that should be maximal too. So this is a very tight rope, and the novice surgeon, I have lived this, when you're trying to get more experience with the surgery, precise decision making is the key, and errors can be very little, and your patients will pay. And in order to avoid, I'm hoping for all surgeons, hopefully these tips will enlighten your way and make the surgery more satisfactory and more easy for you. But please let us hear feedback. If you read our article and benefit from it, I would love to hear from you. And good luck, and I hope very good results with your patients, and enjoy this surgery. It's the most exciting surgery I have ever done in my life. You cannot do the same surgery twice to another patient, and every surgery is very new, it gives you a rush, and the results can be very satisfying if planned good. Thank you for everyone for listening to this.
We'd like to thank the authors for their commentary, and thank you for listening to our podcast. If you'd like to explore more, please feel free to check out the article in print at the Facial Plastic Surgery and Aesthetic Medicine Journal or online. We'll catch you on the next one.